Good day, ma'am, and to each and everyone. So my name is Eliza Crisaco Ferris from BSN 1A of Iloilo Doctors College, and for today I'm going to perform a turn demonstration in regards of assessing the nose. So prior to performing this procedure, we need to of course perform hand washing or hand hygiene and don our PPE if there's necessary. So I have here alcohol that serves as my sanitizer. And after that, we are going to don our gloves because we are going to touch the internal part of the nose of our patient, or we are going to check the internal nose of our patient. And then it is also important for us to prepare all the equipments needed for the assessment. Okay, so the next thing we're going to do is to proceed with the assessment proper. Hi there, ma'am. Good day. How are you doing?
I'm good.
Okay, that's great to hear. So by the way, my name is Eliza Crisaco Ferris and I'm your student nurse for today. So can you kindly confirm to me your name as well as your date of birth?
I am Goodluck Future. And I was born December 16, 1999.
Okay, thank you for that. So that's, I think we're good in here. So what would you like me to call you, ma'am? Is it by your first name or last name?
My first name.
Okay, thank you for that, ma'am Ada. So the first thing we're going to do is to identify our patient. So this is to ensure that we have the right patient in front of us. So it is also important for us to establish rapport as well as identify ourselves towards our patient. So if there's any curtains or doors within the area, we need to close them in order for us to provide privacy to our patient. So next thing we're going to do is to explain the procedure to our patient as well as to position them into a comfortable one. Okay, so Ma'am Ada, so I'm here to perform the assessment of your nose. So why do you have to do this? So this is to ensure that everything is normal. So if there's any abnormalities in your nose, just like if there's any irregularity in terms of the size as well as the shape. So if there's any swelling, lesion, or masses, so we need to take all those abnormalities in order for us to prevent further complications. So do you have any questions or any clarifications to that?
No, ma'am.
Okay, so if you do have any questions all throughout the assessment, don't worry, you do have the freedom to do so, okay?
Yes, ma'am.
Okay. So the first thing we're going to do here is to do the inspection. So what are we going to inspect here? So first we are going to inspect for the external nose, for its color, shape, consistency, as well as its size. Right, so as I'm inspecting here the nose of my patient, she has the color of her nose is the same color as the rest of her face, so that is good. So the abnormal indication of this, if there is discoloration or just like pallor or excessive redness, so we need to take note of them. So in terms of the size and shape, there are smooth and in symmetric form or in symmetric structure, which is good. So if there's any abnormalities in the size or shape of the nose of our patient, so we need to take note of that. Next thing we're going to check here is for the septum, for the alignment or deviation. Okay, so Mama, can you please follow what I'm doing here? Okay, so I'm going to check here for the your septum. Okay, so as I am inspecting here for the septum of my patient, she has a deviated septum, and usually it is an overgrowth of tissue. So it is a normal finding that we have a deviated that our patient has a deviated septum, because as long as it doesn't obstruct the breathing of our patient. So ma'am, do you have any problems in breathing? All right, no. So the next thing we're going to check here is for the mucosa of our patient. So here we are checking for swelling, discharge, bleeding, as well as if there is any foreign bodies. Okay, Ada, can you please do the same thing? Right? Okay. Alright, so as far as I'm inspecting my patient's mucosa, there are no swelling, there are no bleeding as well. So as well as there are no discharge or any foreign bodies that can be seen. So the abnormal indication of this is, of course, if there is any swelling, if there's any purulent discharge. So usually purulent discharge can be seen of those patients with have acute bacterial rhinosinusitis. So there are no also bleeding as well as ulcer that can be seen. So the next thing we're going to inspect here, check is for the transillumination. We are going to check for the transillumination test. So here we will be needing a otoscope. So since I don't have otoscope, we are going to proceed then for the palpation. So what are we going to palpate here? So first we are going to palpate here and check for the patency of the nares. Okay, so I'm going to palpate here, and you're going to take a deep breath for me. Okay, other one. Okay, so do you feel any pain as I do the test?
No, ma'am.
Okay, so I think we're good in here. So there are no abnormalities that occur so far. So the next thing we're going to palpate here is for the external nose, for masses, tenderness, as well as a smoothness or consistency. So I'm going to palpate here your nose, ma'am. You're going to tell me if you feel any tenderness or pain, okay? Do you feel any pain?
No, ma'am.
Alright, so that is a good finding. So if there's abnormalities or any pain that a patient can identify, so we need to take note of that abnormality. So the next thing that we're going to check here is palpate here is for the frontal and maxillary sinuses. Okay, so I'm going to palpate here now. Do you feel any pain?
No, ma'am.
About this? Feel any pain? Okay, so there are no pains, so which is good. So if the abnormal indication of this, of course, if there is any tenderness or pain. So the next thing we're going to do is what we call the percussion. So here we're going to percuss the frontal as well as the maxillary sinuses. Okay, so you're going to tell me, ma'am, if you feel any pain as I do the percussion. Do you feel any pain? Alright, okay, so I think we're good in here. So the next thing that we're going to do is to check for the cranial nerve. So here we're going to check for the olfactory of our patient. So I have here a perfume and a cloth, and I'm going to check if she can smell the perfume. Right, so can you please smell the cloth? Okay, so can you smell the perfume, ma'am?
Yes.
Do you have difficulty in smelling this cloth? Alright, okay. So I think my patient has a normal finding on this cranial nerve testing of the olfactory of our patient. So after this, we are going to remove our gloves and dispose it, and provide the patient care as well as perform hand washing and document all the findings. Okay, so thank you for your time, Ma'am Ada, and then after this, I'm going to document all the findings. Thank you for listening.